Good morning. Today, I, Dr. Neha Ronald William, going to teach you about the peptic ulcer classification and mechanisms. We already studied in the last lecture about the classification. Today, I'm going to discuss about the mechanism of action. Prostaglandin cytoprotective role in the gastric mucosa by augmenting mucus and bicarbonate secretion from gastric mucosal epithelial cell. Soon after secretion, gastric mucus transform into an adherent gel-like film over the mucosa which trap the secreted bicarbonate ion. Prevent their neutralization by recreating a barrier for the hydrogen ion in the juice. Antacids drugs are weak bases that neutralize gastric acid. Major role provide prompt relief from ulcer pain. Proton pump inhibitor. These are prodrugs act by irreversibly inhibiting the H plus K plus ATPase in gastric parietal cell. The drugs in this group include omeprazole, pantoprazole, esomeprazole, lansoprazole, and rabeprazole. H2 antihistamine. These drugs competitively inhibit H2 receptor in parietal cell, inhibiting the acid secretion. Acetylcholine and gastrin act partly by causing release of histamine, therefore aid secreting capacity of these agents also decreased by H2 blocker. Drugs in this group are cimetidine, ranitidine, famotidine, roxatidine, nizatidine, and loxatidine. Anticholinergic, non-selective antimuscarinic drugs like propantheline and ephonium used for increasing gastric acid secretion and by increasing gastric emptying time prolong the exposure of ulcer bed to gastric acid. Prostaglandin analog, prostaglandin E1, prostaglandin E2, and prostaglandin I2 act as anti-ulcer drugs by increasing the release of mucus and bicarbonate and by increasing the mucosal blood flow. Prostaglandin inhibit hydrogen potassium ion ADPase and decrease acid production. Ulcer protective agent drugs form a covering over the ulcer bed and that prevent its exposure to gastric acid. Sucralfate, aluminum sulfate of sulfated sucrose. At pH below 4, its molecule polymerizes to form a sticky layer that covers the ulcer base and act as a physical barrier to prevent acid exposure. It can bind phosphate and can result in hypophosphatemia. Colloid bismuth substrate, it also forms an acid-resistant coating over the ulcer. Reba, ribamipide and ecabet are cytoprotective drugs acting by increasing prostaglandin generation and by scavenging these oxygen species. Ulcer healing drugs carbinazolone obtained from the roots of licorice. It causes epithelialization of ulcer without decreasing acid production, displaces aldosterone from plasma protein binding site, result hypertension, sodium in water retention, and hypokalemia. Anti-Helicobacter pylori drugs. H. pylori infection can be detected by urea blood test. It is responsible for relapse of peptic ulcer disease. Drugs used for the treatment of H. pylori include metronidazole, tinidazole, amoxicillin, clarithromycin, tetracycline, colloidal bismuth substrate, omeprazole, and lansoprazole. Treatment of H. pylori, Helicobacter pylori infection. H. pylori is a gram-negative rod that produces gastritis and subsequent gastric and duodenal ulcer. Therapy include antibiotics and proton pump inhibitor. Proton pump inhibitors promote eradication of H. pylori by raising intragastric pH. Thank you.